My name is Simon Fung-Kee-Fung. I'm a radiation oncologist at Roswell Park Comprehensive Cancer Center. So radiation is a very commonly used treatment modality for treatments of patients with cancer. Typically, radiation is used in combination with a type of breast surgery called a lumpectomy or a breast-sparing surgery. This combination of lumpectomy and radiation has been shown to be a proven alternative to removing the breast entirely in a surgical procedure called a mastectomy. For some patients with more advanced breast cancer where a mastectomy is recommended, there still may be a role for radiation in those circumstances. Some features about the cancer, such as finding out that the cancer has spread to lymph nodes underneath the armpit, whether a tumor in the breast is very large, or whether the cancer was found to be very, very close to the tissue specimen removed from the patient. These all suggest features that the cancer may be at a higher risk of recurrence, and radiation might be recommended in those circumstances to offset or lower that risk of recurrence. Once the decision has been made to proceed with radiation treatment, the first step is to perform a simulation as part of treatment planning. During the simulation, your doctor, as well as members of the radiation team called radiation therapists, determine the treatment position that patients will be placed in. For breast cancer patients, most commonly that is with the patient laying on their back on an angled breastboard with their arms above their head. For some patients, it may be beneficial to lay the patient face down or on their tummy. Most radiation treatments as part of their daily treatment can be done in as quick as 15 minutes. Delivery of the radiation itself is generally on the order of 2 to 3 minutes out of the entire appointment time. As part of the simulation, we do perform a CT scan of the treatment area. The CT scan allows us to customize the radiation beams that are used for the treatment planning and customize it to the individual patient. The beams are customized as well as any shielding or blocking to prevent any normal tissues that are not at risk from being exposed to excessive amounts of radiation treatments. Finally, to ensure that the patient position is reproducible, the radiation therapists place marks on the patient's skin. Most of the marks are semi-permanent, pasted with like a paint pen, and these are the most visible marks. At the center of these marks is a small freckle-sized ink dot, which is placed with a fine needle. Radiation uses high-energy X-rays. Other examples of medical X-rays include dental X-rays, CT scans, mammograms, or chest X-rays. And so patients generally do not feel when a radiation treatment is being delivered. The most common side effects that women experience going through breast cancer radiation tend to be fatigue. Similar to a sunburn-like effect, radiation can cause redness, dryness, irritation or itching, as well as some discomfort or sensitivity in the breast itself. So radiation does DNA damage to cancer cells. Cancer cells are usually not able to repair that DNA damage. As a result, this causes the cancer cells to die or stop from growing or proliferating. Radiation also doesn't distinguish between whether a cell is cancerous or non-cancerous. Our normal cells are able to undo or able to repair that damage so that they're able to survive while the cancer cells are not. As a result, a radiation course is generally broken up into small amounts. They can be on the order of 3 to 4 weeks, and in some very new treatment courses, ultra-short radiation can be delivered in as few as a single week. At Roswell Park, in addition to those options, we have shorter treatment courses where we focus on partial breast irradiation, which can be done in as few as 5 treatments, or other ultra-short treatment courses as well. We customize the radiation treatment to the individual and the cancer that they are facing. Roswell Park is also offering enrollment in a clinical trial that is open across the country as part of their breast cancer care.